Hi everyone and welcome to TS Fibro. Today's video is going to be on Fibro Fog, which we all just love to death. Anyway, if you haven't subscribed, please do so. Little red subscribe button, just click on it. Then a bell will pop up. Just click on that bell if you want notifications of new videos I put up. And if you like the video, hit that thumbs up for me. And if you haven't subscribed to YouTube, it's real easy. Just type in www.youtube.com, and when it pops up on the right hand corner of your screen, it'll say sign in. Just click on sign in and it'll have create an account, and just create an account and then you can subscribe. You don't have to do anything with your account. You can just watch other people's videos and like them, put the thumbs up if you want to, and subscribe to them so you'll get notifications. Okay, Fibro Fog. Have you ever forgotten where you put your keys again? Well, everybody forgets where they put their keys, but not like someone with fibromyalgia. Having trouble remember what you were supposed to do this afternoon? Do you have difficulty finding the right words to use to express yourself? If you are experiencing some or all of these memory problems, you may be suffering from Fibro Fog. Fibro Fog refers to a variety of cognitive impairments that fibromyalgia sufferers experience with this disorder. Fibro Fog can be one of the most stressful and upsetting fibromyalgia symptoms. If you know someone with fibromyalgia syndrome, or if you are suffering from the illness, keep an eye out for the indicators of Fibro Fog. What is Fibro Fog? Fibro Fog is a term given to the variety of cognitive problems that many fibromyalgia sufferers face during their illness. Fibro Fog encompasses memory loss, difficulties using language, and difficulties with learning. These symptoms tend to descend in a haze or a fog around the sufferer. Fibro Fogs can occur at any time and can vary in intensity when they do occur. Fibro Fogs tend to be at their most severe during a flare-up. Fibro Fog affects both men and women who have fibromyalgia pain, though it tends to hit more women more often. When women between the ages of 30 and 50 are most likely to be affected by Fibro Fog. Episodes of Fibro Fog typically last a few days, though sometimes severe Fibro Fog can last for weeks or even months. Symptoms of Fibro Fog. Fibro Fog is one of the most common yet unrecognized symptoms of fibromyalgia. If you have fibromyalgia signs and symptoms, it is important to be aware of Fibro Fog so that you can seek appropriate treatment and manage your illness more effectively. Some symptoms of Fibro Fog include short-term memory loss, difficulty remembering where you put things, difficulty remembering plans, difficulty with language, including trouble holding conversations, understanding conversations, and expressing thoughts, difficulty finding the right word to use in a conversation, trouble remembering simple numbers, transposing letters and numbers, trouble concentrating and focusing, trouble retaining new information. Causes of Fibro Fog. The causes of memory loss and Fibro Fog are as yet undetermined. However, a number of factors could be at the root of these cognitive impairments. It is apparent that there is no real problem with the mental capacities of people suffering from Fibro Fog. Instead, there must be underlying problems that cause the brain to be unable to complete memory functions. Sleep deprivation. Sleep disorders are one of the primary fibromyalgia signs and symptoms. Lack of adequate sleep can affect the brain's ability to produce enough of the neurochemical serotonin, which aids in laying down memory. Decreased blood flow. Studies show that fibromyalgia disability can cause decreased blood flow to certain areas of the brain responsible for creating short-term memories. This lack of blood flow may prevent the brain from adequately creating new memories. Chronic pain. The chronic pain caused by fibromyalgia may actually inhibit the brain's ability to create memories. Processing pain signals take up a lot of brain's time and energy, especially in someone's fibromyalgia. This excessive pain may therefore reduce the amount of time the brain spends on trying to form new memories. Pain also produces amounts of stress, which can be one of the causes of short-term memory loss. Depression. A large percentage of people with fibromyalgia also report that they suffer from anxiety and depression. Depression and memory loss definitely seem to be linked. Depression lowers the level of serotonin in the brain, preventing new memories from being laid down. Low levels of serotonin are also linked with learning difficulties. Effects of Fibro Fog on fibromyalgia. Fibro Fog tends to have negative effects on fibromyalgia symptoms and the course of the illness. Fibro Fog can cause people with fibromyalgia to forget important self-care techniques, including stretching and exercise. This can cause the pain of fibromyalgia to become worse. In a recent study involving people with and without fibromyalgia, those with fibromyalgia reported more trouble with memory, concentration, mental confusion, and speaking. Patients with fibro fog are also complained of more pain, increased fatigue, and more difficulty in sleeping. Frustrating fibro fog. Fibro fog, also known as brain fog, is something that is both frustrating and difficult to deal with for people with fibromyalgia. While we associate pain and fatigue with the condition, and we're glad to talk about that, almost as common is the lack of clarity and mental confusion that can be a daily occurrence for some. Some possible reasons for fibro fog. Several reasons have been postulated as to why people with chronic fatigue and fibromyalgia suffer with this maddening symptom. Cognitive difficulties that make remembering things, staying focused, and using speech appropriately a challenge have been attributed to a number of concurrent physiological processes. It is long thought that fibro fog was a psychological problem. However, several research studies and much speculation have turned up other possible causes. What we know now is that fibro fog has nothing to do with a person's mental capacity, although it may be influenced by a lack of oxygen to the brain. Okay. Here is a list of possible causes for fibro fog. Depression, decreased oxygen flow to the brain, certain medications, poor nutrition, changes to the nervous system, and pain. What the experts are saying: in fact, fibro fog is a type of mental exhaustion, and it is exacerbated by pain and lack of restorative sleep. One of the more popular theories have been that fibro fog is caused by sleep deprivation. At the deepest level of sleep, delta wave sleep, a person's mind is able to sort data, file it appropriately, and discard unnecessary information. The ability to get sufficient delta wave sleep is a real issue for fibromyalgia sufferers. Causes impairment of the ability to recall information at a normal level of mental efficiency. Brain scan studies have indicated that at times people with fibromyalgia suffer oxygen deprivation to various parts of the brain, possibly due to the central nervous system's malfunctions that causes changes in blood vessels in the brain. Recent research shows that the brain may be affected by chronic pain. Using functional MRI technology, researchers discovered that the parts of the brain most associated with emotions fail to shut off when they should in people in chronic pain. In other words, their brains are running all the time and become exhausted. Neurons are wearing out and the balance of the brain is disturbed. It's little wonder that people with fibromyalgia who deal with fibro fog feel like they are mentally exhausted so often. It appears that physiologically they may well be. Research is ongoing and a wide variety of theories are coming to surface. What you can do to get a good night's rest. In the meantime, there are things you can do to dismiss the impact of fibro fog. Since it does connect directly to non-restorative sleep, it is important to do what is necessary to address the sleep issue. Along with a high-quality mattress and pillow in a sufficiently dark and comfortable room, some of the following suggestions may be useful. Stay on a routine, retiring and rising at the same time every day. Make sure the atmosphere around bedtime, both going to sleep and during sleep, is relaxing. No caffeine before bed. If you must eat, eat lightly. Listen to white noise prior to sleep and keep it on during the hours you sleep. Natural sleep aid. Talk to your doctor and see what you two can come up with of what you might need. Living with fibromyalgia fog, helping yourself. According to the Arthritis Foundation, there are some things you can do to help yourself lessen the negative impact of fibro fog through the day. Repeat yourself. Repeat things to yourself over and over again. Repetition will keep thoughts fresh in your mind. Write it down. Whether you write in a calendar, a notebook, or sticky notes, if you're afraid you'll forget something, write it down. Pick your best time. If there is something you need to do that requires concentration and memory, pick your best time to do it. Many people with fibromyalgia find early in the day to be their best time. Get treatment. Depression, pain, and sleep deprivation can influence your ability to concentrate and remember. Getting your medical problems treated may indirectly help your memory. Engage yourself. Reading a book, seeing a play, or working a complex crossword or jigsaw puzzle can stimulate your brain or your memory. Stay active. Physical activity in moderation can increase your energy and help lift your fibro fog. Speak to your doctor or a physical therapist about an exercise program that is right for you. Explain yourself. Explain your memory difficulties to family members and close friends. Memory problems often result from stress. Getting a little understanding from the ones you love may help. Keep it quiet. A radio blasting from the next room, a TV competing for your attention, or background conversations can distract your attention from the task at hand. If possible, move to a quiet place and minimize distractions when you are trying to remember. Are you losing your mind? If you are experiencing problems with your memory, you may be wondering if you're losing your mind. These cognitive disruptions can be very distressing, particularly if you are used to being able to remember detailed information at the drop of a hat. But it is important to know that you are not alone. In fact, a large percentage of fibromyalgia patients experience problems with their memory, and this is often referred to as fibro fog. Fibro fog can leave you feeling as if you are walking around in a haze and can cause a number of worrisome symptoms. Common symptoms include difficulty remembering details, difficulty remembering new information, difficulty finding the right words to express yourself, problems identifying the meanings of similar words, confusing similarly shaped numbers. Are fibromyalgia memory problems real? Those around you may be telling you that your memory problems are just a figment of your imagination. But recent studies now reveal that memory problems and fibromyalgia seem to go hand in hand. A study performed at the University of Michigan in 2002 examined the cognitive abilities of fibromyalgia patients and healthy controls. Involving 69 patients, this study required participants to perform a variety of cognitive tests. Upon completion of the study, fibromyalgia patients were found to perform more poorly on all of the tests when compared to the healthy controls of a similar age. Additionally, fibromyalgia sufferers perform at about the same cognitive levels as the people who were more than 20 years older than them. The study suggests that the memory loss is a true symptom of fibromyalgia. What causes fibromyalgia memory loss? Once fibromyalgia memory loss was determined to be genuine, this left a lot of questions as to why fibromyalgia sufferers experience these symptoms. Chronic pain. A study performed at Northwestern University found a link between chronic pain and memory loss. Imaging studies performed on chronic pain patients showed a 25% increase in prefrontal cortex activity when compared to healthy controls. The prefrontal cortex is also responsible for helping your brain retain new information and short details. However, when pain symptoms were reduced in these patients, activity in the prefrontal cortex decreased and memory actually improved. This supports the theory that pain may have a significant role to play in fibromyalgia memory loss. Sleep and memory. There also appears to be a link between sleep habits and memory cognition. Studies have shown that people are able to remember information better if they have a period of restful sleep in between study and recall. This effect has been termed sleep effect. Because fibromyalgia patients often suffer from disturbed sleep patterns, the sleep effect on memory may be greatly reduced in fibromyalgia sufferers. In particular, sleep disorders like sleep apnea may significantly reduce your ability to retain and recall information. Beating memory loss. Tips for improved cognition. Though memory loss can be quite upsetting, it doesn't have to be a fact of life when it comes to fibromyalgia. There are a few things that you can do to help improve your memory while retaining control over your symptoms. Use learning strategies. Learning strategies are a great way to help your brain remember information and details. They simply provide you with a more organized way of storing and retrieving information. Association. When you are learning new information, try to form an association between individual details. For instance, if you're trying to remember someone's name, Autumn, picture them standing amongst falling autumn leaves. Rehearsal. Rehearsal is a great way to improve your memory. Simply rehearse what you need to remember a few times over and over. This will help your brain to store the information and mark it for easy recall. Visual. Remembering words or direction is difficult because they are abstract. Try to picture an image of what you need to remember instead. Exercise your brain. Just as your body needs exercise, so does your brain. Try to exercise your brain a little every day by completing brain teasers, crossword puzzles, or trivia questions. Find an activity you enjoy and stick with it. Avoid certain medications. Unfortunately, certain medications appear to impact directly on memory. By identifying which of your medications affect your cognition, you can help to lessen your cognitive difficulties. Medications are known to affect memory include benzodiazepines, tricyclic antidepressants, first-generation antihistamines, such as Benadryl. If you are taking any of these medications that appear to be affecting your memory, talk with your doctor. He or she may be able to suggest an alternative medication. Well, that is Fibro Fog. It's a lot of fun, isn't it? Okay, well, I hope you enjoyed the video. If you did, give me a thumbs up. I'd really appreciate it. Thank you to all my subs. I appreciate every one of you. And hopefully I can go live when I figure all this out. Anyway, thank you so much. God bless. I pray for a cure, and I pray you have a pain-free day. Bye, everyone.